we're going to talk about what to do with your eyes during breath. When we have a contraction and we want to use breath, we want to focus on our breath. That's what makes it most powerful. So what we want to do at the same time is kind of block out anything that's taking our distraction in our mind away from that breath. And there are two strategies for this, and they involve your eyes. So the first strategy is using something called a focal point. So you might be familiar with this. A lot of people in sports use focal points. Definitely if you're doing meditation and that kind of thing, you might be familiar with focal points. But what that means is picking something to look at while you're doing your breath. And by looking at that object, that place on the wall, that focal point, it helps you quiet your mind. It helps you focus on this one task of breathing. And as we quiet our mind, we block out some of those thoughts that we really don't want during a contraction, which are things like, how long is this contraction? This is really painful. Is this almost over? I don't like this. I want this to end. Those kind of thoughts are not helpful during labor. They're not helpful during that contraction. And if you have never been in labor, just think about any time you've experienced pain. When you're experiencing pain, you don't want to think about more pain and more pain and more pain, right? You want to think about something else. And I always call it the nice part of labor is that contractions are not constant. They come and they go. So during this contraction, I kind of show a contraction like this. I talk about contractions like this because they build in intensity and then they go down. During that whole section, that's when we're going to use that breath. We're going to use that foundation. And if we have a really great focal point, it's going to help us quiet our mind. Okay, so my favorite focal point is this product. These are battery operated candles. So this pack is a pack of 12 for $7. They last so long. Trust me, as a doula, I have kept these on for hours and hours. So it's because in a hospital setting, you don't want to use anything with an open flame. You want to have something that is, if you're going to use a candle, these are awesome. So can you kind of see how it makes a little bit of a flicker? It looks just like a real candle, which is awesome. So what we're going to do is use this candle as a focal point during our labor, during our breathing. So say when we practice, we take a breath in and we are basically just looking at this candle during our breath. We're trying not to, when we use a focal point, our eyes are fixed and we're not looking around the room. We're not looking at anything. That is our absolute laser focus. And it really helps as you get into this groove of breathing. It really helps you quiet that mind around you. Do you need a candle? No. Could you use something else? Yes. You could use a photo. Some people I've seen use a photo of their pet. I've seen people use a little mark on the wall, just something, the light switch or something like that. But I really love these. Okay. So this is one option. When we practice, we're going to do 5 breaths using this option. Our other option is to use closing our eyes. So closing our eyes, that's my personal favorite, like the one that really works for me when I am in labor or when I experience pain, because it just helps shut out the world. And I love this one when you are in labor in a hospital setting as well, because it sort of notifies everyone around you that you're having a contraction. So sometimes, especially if you're someone who kind of goes inward when you experience pain or kind of are dealing with something, it helps, say your nurse who might be about to ask you a question or, interrupt you in some way. They have things they have to do, but they can pause if you're having a contraction, but they don't know if you're having a contraction sometimes. So if you just close your eyes and start breathing with your eyes closed, it gives them a really good indication that you're in labor. What we can do is just practice with our eyes closed, and our eyes closed, it blocks out what's going on. So if you were, some of the hard parts of labor are when you're transitioning from spaces, like when you're in the car ride to the hospital. That can be kind of hard. Eyes closed, great for that. If you are in a cesarean birth, if you're, waiting as they get everything prepped before the surgery, great time to close your eyes and do your breath and really put yourself somewhere else. Close out some of the uncomfortableness of the situation. So the nice thing about closing your eyes is it's always available to you, right? Unless you're, walking or something like that, you don't want to close your eyes. It is available to you, and it's easy, right? You don't have to think about it. You just close your eyes and you're there. So 2 different ways to use your eyes in labor. I just really love that you have those 2 options. Okay, so it is time to practice. And what we're going to do is, first of all, pick a focal point. Or if you want to focus on the screen, I'm going to hold the candle up for our focal point during our 5 breaths. So we're going to do 5 breaths. Again, nice big breath in, nice big breath out. And we're going to do that for 5 breaths. And then after 5, I'm going to say, close your eyes. And then we'll do 5 with our eyes closed together. Now, if you're thinking, is this practice really necessary? Or if you want to skip ahead through the practice, this is the good part. This is the part that's going to really build that foundation in your brain. And so when labor starts, you're going to be able to go to it, right? So let's do it. Let's get a little comfortable. Pick a focal point. I'm going to hold this candle right here like this. So if you want to focus right here on the image on the screen to practice with me, let's do it. Okay, now let's practice with our eyes closed. I'm going to close my eyes too. Ready? That's 1. 2. 3. 4. 5. How did that go? So if you did practice with me, high five. That is going to only benefit you for the big day. At the end of every class, I recommend going to the links down below is the affirmations video, whether you're in your first, second, third trimester, or you want to listen to the labor and birth affirmations. If you're trying to build a practice of building your mindset for birth, then this is a great time to do it because you're already here practicing breath. You might as well do some birth affirmations as well. And I'll see you back here tomorrow. Thanks for joining me today. Bye, everybody.